Hi everyone, welcome to today's webinar. We are going to go ahead and give you guys about a minute or so and let everyone log on. Okay, hello and welcome to IDD Perspectives Trauma-Informed Care for People with IDD. My name is Taylor Nubner and I'm the Communications Manager at Intellectability. We are so excited to have you all here today, but before I turn this over to our presenters, I have just a few housekeeping notes. These can be referenced in the chat feature of your control panel. If you are having audio difficulties, please check your speaker selection and volume. If that doesn't help, try leaving and rejoining the webinar or restarting your computer. This topic is likely to spark some questions, so please feel free to use the questions feature in your control panel, and our presenters will make time to answer questions during the last 5 or 10 minutes of the webinar. This is being recorded, so 1 hour after the webinar concludes, you will receive an attendance certificate and a link to the recording. We have a free resource sheet PDF available to download in the handouts section of your control panel. And last but not least, there is a link to our webinar survey in the chat, so we encourage you and welcome your feedback. So please take a few minutes to fill that out for us. And that wraps everything up. We are ready to get started. So now over to our lovely presenters.
Thank you, Taylor, and welcome everybody. We're so glad to have you here. We have an amazing turnout for this webinar, and I'm going to say it's because of the amazing guest that we have, Dr. Karyn Harvey. So most of you know who I am. I'm Craig Escudé. I'm a family physician by training. I spent the majority of my clinical career providing health care for people with IDD and complex medical and mental health problems, and learned a lot of things the hard way. Now I get to work with Intellectability, where we provide tools and training to state agencies and provider organizations and supporters of people with IDD to help improve health outcomes overall. So I'm going to stop talking about myself, and I can't wait for you to hear from Dr. Harvey. So Karyn, I'm going to turn it over to you to introduce yourself.
Thank you so much, Craig. I am so honored to be here with you. I have so much admiration for you and so much admiration for Intellectability and the great work that you all have done. So thank you. It's wonderful. I'm around. I'm old. You're not getting rid of me. I won't go anywhere. And I'm a psychologist, and I've worked with folks with IDD for close to 40 years, and these are my people. And early on, I started realizing that a lot of the behavioral interventions I was doing, a lot of the staff training wasn't working, and that I was missing the fact that folks were really traumatized. So I just dedicated myself to trying to figure out trauma and what people need for real support in that area, and how to help staff to get the tools that are needed as well. So that's a little bit about me. Thanks.
Wonderful, Karyn, and again, I'm so happy to have you here with us today, and as I know everybody else is. I want to let everybody know, as we're talking today, keep in mind I've got a kind of a special announcement right at the end. So hang on, everybody, as we get to the end of this here. But Karyn, I want to start with you just talking to us about trauma in this field. What does it mean? How is it described?
Thank you so much, Craig. The reality is that trauma isn't necessarily the objective, what happened to somebody. What happened to them is big, but it's how what happened to them impacted them and made them feel. And there's so many sources of trauma with folks with IDD. For years, I was talking about trauma because I started to recognize that a lot of the behavioral issues that I was dealing with were actually symptoms of post-traumatic stress disorder. But yet there were many people who believed that folks with intellectual disabilities were not as impacted. McNally et al. Did some great research, and they showed that they're actually more impacted. that folks with intellectual disabilities actually have complex trauma in many cases, or layer after layer of trauma. Julie Gentile, she runs a clinic. She's a brilliant psychiatrist who runs a clinic for people with IDD. And she speaks about the fact that post-traumatic stress disorder is actually way underdiagnosed and the most common mental health issue with folks with IDD that come through her clinic. And Kiesler agrees that PTSD is underdiagnosed. So the research is now coming out supporting the fact that people are more impacted by trauma who have IDD rather than less.
That's pretty fascinating when you think about it. And I know in my experience and just throughout my career, I think there's in general, there's an overdiagnosis of things like psychotic disorders and schizophrenia, and there's an underdiagnosis of the more common things that we see in everyone, things like depression or anxiety, and that fits with trauma too. I think there's been this mindset that, oh, people, with intellectual disabilities don't experience, depression the same way that we do, or experience trauma the same way that people with intellectual and developmental disabilities do. But in fact, it's quite the opposite.
Quite.
Yes, absolutely. And we're going to get into some of the specifics about the types of trauma and the sources of trauma that people experience and have experienced, and that's one of the things that I find so fascinating every time I talk with you, as I learn new things about this. So let's talk about some of the sources of trauma for people with IDD.
Thank you. Well, the statistics say, the Bureau of Justice reported to Joe Shapiro when he did his NPR special in 2018, he asked the Bureau of Justice, will you look at how many sexual assaults actually happen to people with intellectual disabilities versus people without? And he focused in on intellectual disabilities, and they concluded, based on their reports, that people with intellectual disabilities are 7 times more likely to experience trauma.
That's an incredible number.
Of sexual abuse. Yeah,
yes.
Crazy to be sexually abused. So listen to this, though. That's the people that report, Craig.
You're right.
So I've been in situations where they did not report. I've been in so many situations where the police were there, because I'm often involved in these situations as the therapist and the clinician in the house with provider agencies, where if the person was non-speaking, the police said, sorry, we can't take a report, we can't do anything, when we knew something happened, when we were sure of it. So the sexual abuse is so high. A recent piece of research by a guy named Thompson and his team said 1 in 3 adults with intellectual disabilities throughout throughout the world, that was an international piece of research, will encounter some kind of sexual abuse. So these are really horrifying statistics. And he said the most common is something we don't look at very much, peer-to-peer. That often that happens behind closed doors, and we don't really, in situations, he said the worst situation, peer-to-peer, and also staff to individual sexual abuse, is in institutional settings or congregate settings. So these situations still go on and are still present. Then, of course, physical abuse, bullying, just about everybody that I've worked with has been called the R word, has been bullied on some level, and that has giant impact. We cannot underestimate that. And the marginalization, the exclusion, to be marginalized is the worst, right? It's Mel Baggs says, rage is nothing in comparison to erasure. To be erased is its own kind of trauma. Yep. To not be seen, to not be heard. Mel talks about being an unperson. And the impact of just not being there, right? That's its own kind of trauma.
Wow, yes.
Yeah.
Not being seen, not being heard, not being valued.
And that's everywhere. We've got to change this, right? I mean, it's getting somewhat better, but we still have so far to go. And then, of course, institutionalization still happening. Residential treatment centers, the Judge Rottenberg Center still operating. So many places where people are being restrained and secluded, and negative techniques are being used in institutional settings.
You know, Karyn, when you and I started in this field, you know, just a short time ago, there were many more institutions, and some of the examples that we've talked about before of institutional trauma are things that I just hadn't really thought about, and things beyond actual physical trauma or you know, some sort of practice that's not very appropriate, but simple things. I think you've mentioned things like just eating, and people who might have a pattern of eating super fast that puts them at risk for aspiration. That can be a result of, well, I'll let you describe that.
Thank you for saying that. And
Yeah.
I've heard you speak about it, and I just appreciate so much the light you shine on these issues. But all of us have worked with people who hoard food. All of us have worked with people who stuff food. And sadly, I lost 5 different people at 5 different points in my career because they stuffed food and choked. Every single one of them were in situations of being deprived of food. And in the institution, in many institutions, when I go all over the country, I hear this story again and again. The food was put out for people. They didn't get their own place setting. They didn't have time to eat. They just had to fight for their food. And sometimes their food got stolen. And then there are folks that I've worked with who are in repeated foster care settings. And in some of those settings didn't get enough food. So all these food issues can come back to that childhood trauma or any trauma at any point in life, but of having food deprivation.
So if you have a person who eats really, really fast and it's a danger to them, and they've maybe been in an institution before, they might have had to learn that, well, the only way I'm going to get enough to eat is if I eat as fast as I can and faster than anybody else around me. So that pattern of eating fast was a result of not having a lot of time to eat. Did I summarize that pretty well?
Thank you. I mean, you've done such important work around that as well. And just the fact that you have to fight for your food. So then you're going to stuff food quickly because it might get stolen. You might even steal food. You might do whatever you have to do not to starve, you know, or at least that psychological feeling of I might not have enough food, right, is the trigger for so many people.
And you know, that's something, if we just see the person and we met them today and we see that they eat food really fast, it almost might make us upset. And so why don't, you know, stop eating so fast? And we just want to tell them to stop eating so fast. But the bigger question is why are you eating so fast? What caused this to happen? And then trying to address those underlying trauma things. And does that make sense? Am I saying that right?
Beautiful, Craig. You're better than I am.
No, I'm not.
You are so I've worked with people in that way where they have food access to food, where they have snacks that they're available to them, and maybe they're low calorie snacks, or they have, in some cases, they have their own special refrigerator with those special snacks, you know, low calorie, but that they can constantly have access and not have that sense of panic and freaking out like, oh no, oh no, oh no. But how can we make it a safe place? Everything's about safety, and a big piece of safety is knowing you're going to have enough to eat.
So before we go on to the next topic here, someone asked to repeat Mel's quote. Could you repeat that again about rage?
I will. And I just want to honor Mel Baggs, because sadly Mel passed away in April of 2020, and such an important voice in our field. Rage is nothing in comparison to erasure, right? So being erased, rage is nothing. So they were saying, you know, it was horrible if someone yelled at me, but it's worse than when they just ignore me. And how often are people ignored? And how often are their needs not met? So, you know, or sometimes the basic needs are met, but no one's listening.
That's very impactful. The more that you unpack that and think about it, pretty impactful there. So Karyn, do we should we just, you know, look for trauma when we see it, or should it be really obvious to it, or should we have more of kind of an assumption that people have been through some things that might be causing their behavior? And obviously that's a very leading question to the next slide here.
Craig, I think you're psychic. You must be reading.
No, I have the slides in front of me.
Assume trauma. For years I developed an assessment tool for trauma and folks with IDD because our normal assessment tools don't always adapt. I know some other people have developed some things in the meantime. We had a checklist when I worked with the University of Georgetown USED. And at the end of it all, I just concluded, wait a minute, I think we need to just assume trauma. Everybody I've ever worked with has had some kind of impact with the disability. They've had the ableism. They've been the brunt of ableism in some way. They've been excluded. They've been laughed at. If you think about middle school, we've all maybe had a bully. Maybe there was a mean girl or a rotten guy or somebody did something. But then if you think about what that person in your school with a disability went through on a daily basis, we can assume trauma.
Yeah.
Bullying is trauma. Exclusion, being excluded is trauma. I've had people tell me, I know I'm not going to be able to join that club when we try and encourage them to join some club in the community because no one ever let me in a club. So I'll never be. And that, just that real, it's a symptom called negative alteration in cognition mood, just sense of impending doom and sense of the defeat before ever trying, these symptoms of PTSD that people express to me so much. The rejection,
Yeah,
as well.
I want to expound a little bit on ableism and how that relates to trauma. So ableism is where I guess society and environments and ways of thinking favor able-bodied people. How does that relate to trauma?
Oh, thank you. So it is discrimination, and being discriminated against in any way, shape, or form is trauma. Racial, cultural, developmental, all trauma. And some folks have experienced the intersectionality of all that discrimination. We can't discount the effects of discrimination, and people are discriminated against because of disabilities, and sometimes because of many things that are all intersect. And it is impactful.
I think it's a little bit related to, and I'm interested in your thoughts on this, to bias or implicit bias. We all have biases against things or towards things. It's just part of human nature. I don't think the key is getting rid of biases, because I don't know that that's all that possible, but it's certainly being aware of biases that we have so that we can address things in different ways. Does that relate to trauma a little bit as well, if we're biased?
That's such a point. Yeah, that's a great point. I mean, yeah, we all have biases, but we can re-examine our biases. We can work on ourselves, right? And I think we need to have more media exposure, and we're getting a little bit more media exposure of folks with disabilities. We need their voice out there. We need people to see and hear how wonderful they are. There's a fellow named Frank Stevens, and he was in Champions, and he's a great actor in Peanut Butter Falcon, outstanding. And he speaks up and he says, I'd like you all to examine the fact that you're aborting people like me.
Wow.
That you get tested and the doctor tells you you should just have an abortion. And I've had so many families come to me and say that they were pressured by the doctor's office to schedule an abortion after an amniocentesis positive for Down syndrome or spina bifida or any of the other things that can be screened. So that is, it's in the medical system. And I've had one family told me they had 6 calls from the doctor's office pushing them to schedule an abortion, and they had to get a lawyer and say, well, we're getting a lawyer to get those calls to stop, which is very similar to the way the doctors pushed it back in the day, institutionalization. Now, that's not everybody. I'm not saying all doctors do that. Of course, you're a doctor, you don't do that. But I'm saying that is institutional ableism. And just to think that this still goes on, and that people with Down syndrome are aware of it. People with spina bifida are aware of it. People are aware that they're targeted for abortion in utero.
Wow. Yeah. Again, just another facet of trauma that we don't always think about. I'm watching a few questions and comments come through, and a couple of them are related to what we're talking about, so I'm going to ask them now. One person wants to know who the actor was again, the actor you just mentioned.
Frank Stevens, and Stevens with a P, P-H-E-N-S, Frank Stevens, fantastic actor. And if you look on YouTube, you'll see him pleading, stop aborting us.
Frank Stevens with a P. And here's a difficult question. Do you think that some individual parents are guilty of ableism, thinking their child is never going to be able to make choices for themselves?
That's a complex one. And what I'm going to go to is something that I've been writing about and talking about, is that the trauma of families. So that might be a symptom of their own PTSD.
Yep.
The trauma begins with the diagnosis. We cannot discount how hard that is for families. And yeah, maybe they become overprotective because they've experienced the discrimination. Because I've had many families tell me that other family members back off, that friends stop contacting them and stay away from them. They lose a lot and they become isolated in many cases, not always, but families are really suffering. And one of their trauma responses is to become overprotective and overbearing, maybe because of their fears and because of what they've been through. We need to get therapy for folks, but we also need family therapy and supports. To me, the best intervention with families has always been parent groups, because some that are further along can help the others, but that the trauma there is very real.
Yeah.
And people need support.
Yes, we all need support. All of us do. Speaking of a particular type of trauma, let's talk a little bit about betrayal trauma and what is that and how does it manifest in this world?
Thank you. So this is Tamika, and Tamika asked me to tell her story. So I've been telling her story for years now. She used to say at her meeting every year, when they'd ask her what she wants at her person-centered meeting, I want a boyfriend. I want a boyfriend. And that was kind of brushed over. At one point, she did like this Guide the Day program, and they went to his mother and tried to set up a date. And the mother said, oh, no way. My son is not dating. And, you know, I look back on that as that we could have helped. We could have talked to that mom. We could have introduced her to other parents who allowed their kids to date. But we just said, oh, well, can't do it. And Tamika kept wanting that. When they asked what goal we're going to work on, she'd say getting a boyfriend. And everybody at the meeting would say, well, how about the cooking goal? I have a cooking goal, Craig. It's not to cook. It's going really well. My husband's doing a great job. He retired.
I remember you telling me that before, yeah.
Anyway, that's my joke. But the reality is that Tamika wanted something very real and very important, and they did give her alone time. She started walking, and there was someone who saw her taking walks. He started giving her rides, grooming her, and then he said the magic words, which were, I'll be your boyfriend.
Ooh.
And then she was so excited. She came home, told everyone she had a boyfriend. And then, kind of trigger warning here, this is a hard one, but then he brutally assaulted her.
Oh.
She got home. Thank goodness she got home. And she said to them, she was kind of a mess, but she said, but hey, that's what you have to do to have a boyfriend.
Oh.
And they took her to the hospital, got the same exam, and she was shattered. But that wasn't abuse. That wasn't assault. That he was going to marry me. Oh no, he's a registered sex offender and he has a wife and kids. And then I started doing the therapy with her, and we did EMDR, working on the trauma. We did positive identity development, which is my approach. I have a number of workbooks on my website, KarynHarvey.org, to use to help people to have a sense of self. And we built her up. And then she went to the agency and said, you know, I want to live with young people. She was living with all older women. And she said, I want to go out. I want to have a life. And they listened. Once she found her voice, she was able to really advocate for herself through the therapy and through the treatment. And then she was able to start dating and having people in her life. But I realized during that work that so many people that I've done sexual assault counseling with, the crisis counseling after the assault, the real problem, the real source of vulnerability was their loneliness, was the isolation, was the fact that they were so desperate to have a relationship. And Tamika's a loyal person. So if we had really done our job, if we had really listened to her, she would have said to that guy, I've got a boyfriend. I'm good. She wouldn't have gotten that card. The real source of vulnerability is the isolation and loneliness that so many people suffer with. And so many people that I work with really want that relationship. And somehow we're not always supporting that or helping them to get those skills or helping them to find that person. I've done speed dating with a couple of agencies in slow motion. Got to go a little slow. We have a dating app that I help consult with. Hello, it's me. I think whatever we can do to support people in having relationships is how we can offset that loneliness and understand too that the trauma that they experience, the core of it is often the betrayal, the lies, the gaslighting. So many people are lied to and also discounted. You know,
Wow.
we didn't listen.
Yeah, Karyn, I mean, this is so impactful and so important and so difficult. It's difficult for family members to know how to best support their child, for instance, who wants to date, or for supporters who work for organizations to know how do we support someone who wants to have a relationship with someone, but you know, I'm responsible for keeping them safe. How do we balance that need to help a person be safe with also the things that they want for their lives? And that's a challenge, and it's difficult. And I will just throw in that one of the ways to do that is to learn about person-centered thinking and person-centered supports and how to balance those types of things. In fact, there's a little bit on person-centered thinking in the handout that you have that you can download in the handout section. And I'll also tell you, we did a webinar a few months ago that you can go on our website and look at, called Tara Wants a Boyfriend. And it's how to support someone to be safe and want a boyfriend, or facilitate them having that interpersonal relationship. So take a look at that as well too. So Karyn, we've talked a lot about types of trauma and the ways that it might manifest. How do we move someone towards recovery from some of these traumas?
This is the most important question. Thank you, Craig, because people do heal. People heal. And Tamika healed. You know, people heal, but we have to listen to them, right? We have to really hear them. And to be person-centered is critical, not just person-centered on paper or on a computer, right? But real, like I know you did a wonderful webinar with Tanya Richmond, and she hit all those points. It's so important, right? Are we listening? Are we really hearing what people are trying to tell us? So the necessary items for post-traumatic recovery: safety, safety, safety. People need to feel safe. They need to know that the people they're working with care about them, that they are in a situation where they're not going to be mocked, they're not going to be excluded, they're not going to be discounted, they're not going to be marginalized. And once they get into that, it's amazing how people blossom. So I've been having a joyful experience of training trainers in many different places. And I always ask the trainers, who are people who work in the field of IDD, to tell a story about somebody who's had trauma and who's healed. And I have heard now, I think I should have recorded them all. I've heard hundreds of stories of people recovering. And my own experience in working with people is when they feel safe, when they know that they're going to be okay, they blossom. You know, when they have staff who listen to them, when they have support, when they can try new things, when they're not judged and shamed, they blossom. And I heard a beautiful story yesterday about a woman where there was a 2-on-1 working with her, 2-on-1. They had face masks and protective gear, and they brought her to this new agency, and they said, watch out for her, she spits, and she's a spitter. They called her a spitter, right? Yeah. And the agents took her like, oh no, now we have this person who's spitting. And then they realized, we don't know anything about her. And they started to get to know her, and it turned out she was living alone without support, which she did need support, but with her daughter. And one day, both Adult Protective Service and Child Protective Service came in, removed her from her home, and removed her child, who she never got to see again.
Ooh.
And oh, no wonder she's spitting. No wonder she has behavioral issues. And once they saw that and they started talking to her and embracing her, this woman blossomed. Nobody needed protective gear. She stopped spitting. She realized they cared. She was finally safe, and she had a beautiful, rich life, and she got to be able to connect with lots of people. She had a boyfriend. She could rebuild her life. She was able to rebuild her life. And they said, once we got her, once we listened to her, then we realized, oh, there's a beautiful person inside who just needs to know she's going to be okay. And wow, I hear story after story like this, where people figure out how to create a safe environment for someone, how to show them that they're going to be okay. And then that person settles and can be themselves. People also need connection. They need relationships. I want to watch that Tara get a boyfriend. That's important. It's actually crucial. I'm so glad that you do that, because we have to educate. We have to educate everybody. Many people that I've worked with through the years have told me that they did not get sex education when everybody else in the school got it. They didn't bring in the special education, the special ed classes. They said, oh, well, you guys don't need this. No, they need it more.
They do.
So,
they do. And in fact, the studies have shown that when you provide that education, they have lower incidences of abuse, because they understand things and they've been provided ways to recognize dangerous situations and what to do about them. So
exactly.
Yes. Yep.
Thank you. That's it. We have to educate, and we should educate staff. We should educate families, so everybody gets it, that we can do this. People deserve relationships. They deserve love, and they deserve friendship, and they deserve relationships that are not paid. And that means we have to change the paradigm of staff. They're not the caregiver. They're not the friend. They're not the, whatever controller. No, they're the coach, and they can coach relationships. They can help that person to have somebody who's not paid in their life. Maybe somebody they can live with. Maybe somebody they can have a family with.
So to recover, or to aid in recovery, person has to feel safe. They have to have connections, right?
That's
or that
right.
helps, at least.
Yeah.
People they can trust, and then empowered. What does that look like? Empowerment.
Yeah, that looks like a voice that's heard. That's really important. And there are non-speaking people who are discounted, who are trying to tell us and can tell us what they need. We need to learn how to listen. And I've been told by so many people, all behavior is communication. It shouldn't have to be. Nobody should have to use their behavior to communicate. That's not okay. We need to get better at listening. We need to get better with assistive technology, AAC. We need to learn how to support people. We need to listen to the message and then respond. We need to truly be person-centered. It's so critical, and that's trauma-informed. And people do heal. When they have these things in place, they heal. When they have real relationships, right? When they have real situations where they have the life that they've dreamed of and they want to, even just in a simple way, in a day-to-day way, right? Of having someone they can call up and just shoot the breeze with, having someone they can talk to when they have a problem, rather than be constantly told what to do or how they feel. And that empowerment is critical.
Yeah, if we just think about it in our own lives, we feel better when we get to talk to a friend about something that's going on that's difficult in our lives. People with IDD are people and have the same likes and needs and desires and interests and all of those things that everybody else has. And we think about what's comforting to us. Probably some version of that would be very comforting to people that we're supporting as well too.
Exactly. I mean, how many of us, something bad happens, we have a friend we can call, or we have a spouse we can talk to, and a lot of folks don't.
A person we feel safe talking to, so that safety component as well. And yeah, it all just, it makes sense.
The Harvard study showed us, the Harvard men's study showed us that relationships heal. They took people from Harvard who had all kinds of privilege, and the people from the poorest section of Boston, they followed them their entire lives. The happiest and most fulfilled people were the ones who had the best relationships. not the ones who have the most money, the best position, the best education. Relationships. Relationships do several things. They help us to heal from our trauma. They bring us into the present, and they also inoculate us from further trauma because we have someone we can go to. We have someone we trust.
Absolutely. So a person can recover from these things. We know that. You've shown that. We've talked about that. What happens after a person is recovering or in the process or recovers from some of these things?
Thank you. Well, I love the concept of post-traumatic growth. And I've been wanting to talk more and more about that because sometimes the trauma can become a superpower. If you recover, if you move forward, people with a lot of trauma can also be the people who are most compassionate. They can be the people with the most understanding. They can be the best friend to somebody. And that love and friendship can be very profound. I went to a beautiful conference, organizations called TASP, T-A-S-P, and they support people with disabilities who have had children to be able to raise their children. There's lawyers, there's psychologists. They fight so hard to help people to get the support that they need. And some of them, I met many people, and some of them were just the most amazing parents, you know, because they've been through a lot and they fought so hard to have their kids, and they have staff support and they have family support. You need support, but yet they're doing things that we haven't seen people do. And a lot was the trauma they've been through informed them and made them value humans and made them more compassionate and made them try so hard to give the love and support to their significant other, and in the few cases to their children where they have that, and not lose those children or get those children back, and to just friends, right? So oftentimes the most intuitive, in tune, caring people have had a lot of trauma and have healed. You have to heal. You have to be able to move forward. And I believe therapy is really important. And we have to access more therapy for our folks, because that's a hill to climb. Actually, it's a mountain, right? To try to access therapists and make that connection, and find therapists willing to work with our folks and help them to feel comfortable in doing that. But after that healing, the growth is very profound. And I've seen people have beautiful relationships and, you know, be able to help many others and advocate for others.
This brings to mind peer support specialists, people who have experienced similar things or in similar circumstances, supporting other people. And many of those people, I'm sure, have experienced some of the same types of trauma that they might be helping other people with. Does that kind of fall into this some way?
Oh, yes. I really strongly believe in that. And I believe in my favorite type of therapy, let me tell you, is group therapy, because I don't have to do anything. It's amazing. And I get in group therapy how amazingly gifted people are at helping each other. And group does so many things, because people can see that they're not alone with their issue, but they also see themselves helping somebody else. And it's incredible and it's impactful, that peer support. And sometimes that's actually the most effective of all kinds of interventions.
Yeah, that makes sense. So Karyn, gosh, we've covered so many things, and I can't tell you how many people are commenting and questioning and echoing. So I want to take a few minutes to sort through some of these. I'll start with one question that someone asked, and they were curious about the dating app that you mentioned for people with IDD. Can you talk a little bit more about that?
Yeah, the app is called Hello, It's Me. I love that name. And we have many stories that are animated by wonderful animators. I wrote the stories as a consultant. I consult with them. I don't get any money if anyone joins, just want to establish that. But it's really designed as a safe place for people to be able to date. We have an administrator that actually monitors keywords in case somebody's asking over and over about sex or money. So we try to really weed out whatever catfishing we can, because we know a number of folks go on Tinder and do get catfished. And I've worked with many people that have got themselves into situations where they gave money away. So we try to make a safe place where people can date. It isn't required that you have a disability, but it's very clear on the website that that's what's being supported. And all the stories are about people with disabilities having relationships, coming out to their mother, having a breakup, getting married, all different scenarios, so that we try to create a safe place where people can meet online. And my kids both met their significant others on Bumble. I owe my granddaughter to Bumble.
It's
Just
the
saying.
way of the world right now, isn't it? Yeah. So great. Hello, it's me. That's the app, right?
Yeah.
Okay. All right. Another question. Would being ignored by support staff fall into the betrayal trauma category?
To me, it does. And that's a fantastic question. I usually refer to it kind of as marginalization, and folks are marginalized in so many aspects of their life. I love thinking about it as betrayal. That's a great insight, because it is, because this person signs up to say, I'm going to be there for you. And then they're not emotionally, they may be physically there, but they're not otherwise. And I've had many folks tell me. I've also been involved in situations where folks will make a false accusation. They get stigmatized then in the behavior plan for making false accusations, but there's an emotional truth. So if somebody's ignored them and been very cold and dismissive to them, they have said in the past, a bunch of people I work with, oh, they hit me. Then we investigate, they didn't hit them, but they were ignored. And they knew if they said I was ignored, that it wouldn't be responded to. So there's so many responses that are trauma-based to that level of betrayal. I love that. I've been calling it marginalization. I'm going to call it betrayal. Thank you.
Yeah.
It is. It is.
So again, there's no way we'll get to all of the questions and comments, and I thank you everybody for being so engaged, but I have one more I want to ask. Who is providing education on healthy relationships, domestic violence, sexual assault in this field? Is there any group or people that you could recommend?
Yes, Catherine McLaughlin in Elevatus does a wonderful job, and they are a fantastic organization. I've also used, in the past, we've used Planned Parenthood. And in the Hello, It's Me app, we're in the process of designing curriculum for staff to how to support relationships. And I think, more and more people are popping up realizing the importance of doing this. Yep. It's really critical. Yeah, I've done this training myself with a number of folks receiving supports, because I think it's, we train them in so many other things. Let's train them in these basic social skills. I could have used that training early on, I'll tell you. Absolutely.
I could have used a lot of training early on. And fortunately, there's more that exists now. And as we close out this webinar, we try to keep them to 45 minutes when we can. And I want to remind you that there are some handouts in the handout section. There's a PDF of these slides, as well as a handout that has a few of the clinical pearls from the book Clinical Pearls in IDD Healthcare. But with so many questions that all of you have had, and the comments and the thoughts, and talking about the importance of training, here's the surprise I wanted to tell you about. You've heard from Dr. Harvey today, right? Well, Intellectability has partnered with Dr. Harvey to create a trauma-informed e-learning course. This is a fantastic way to bring Dr. Harvey into your programs, into your organizations, to teach everyone, to teach support staff about trauma, recognizing it, how to address it, what to do, to help ensure that we're looking at these things when we're supporting people with intellectual and developmental disabilities. And this is pretty hot off the press, I will say. It just got released just in the past few weeks. So I invite you to scan the QR code that you see on the screen, or just go to our website, replacingrisk.com, and look under training, and you'll see information about this brand new trauma-informed support e-learning course. So very excited about that. We love to get your feedback. So again, you can find a link in the chat about or a link to give us your feedback, but also on the handout, if you download it, there's a link there too as well that'll get you to the survey. We want to hear about more things that you want to hear about. and address as many needs as we can. And I also want to remind you about the IDD Health Matters podcast. Dr. Harvey has been a guest. Fantastic episode. You mentioned Tanya Richmond with person-centered thinking expert, recently released an episode as well. There are over 150 episodes out right now, so we encourage you to take a look at the IDD Health Matters podcast. And with that, we're going to close out today. Dr. Harvey, thank you so much for being here today and sharing your amazing insights. I always love talking to you, and I can't wait to do it again sometime soon.
Oh, the pleasure is all mine. Thank you so much. And thanks to everybody here.
You are very welcome. And again, people are asking lots of things about what we talked about and the podcast. Just look up IDD Health Matters podcast. That's how you get to that. And our website is replacingrisk.com. So thank you again. And Taylor, I'll turn it over to you to close this out.
Thank you so much, Dr. Escudé and Dr. Harvey. We hope you enjoyed this presentation and that it inspired you with ideas. If you would like to explore those ideas with our team, we're here to help. So request to connect with one of our sales representatives to discuss ways that Intellectability's tools and training services might support you and your organization. Again, please take a minute to fill out our short survey and have a fantastic rest of your day.
Thank you.